Hi, let's talk Fuchs dystrophy. So what is Fuchs dystrophy? So the cornea is the front window of the eye, and the way I explain this to my patients is that the cornea has several layers to it. The innermost layer is nothing but a layer of cells. And the job of those cells is to pump water out of your cornea at all times. So your cornea is constantly bathed in a nutrient-rich fluid on the inside of the eye, the aqueous humor. And the job of the cells, the endothelial cells they're called, the cells on the inside layer of your cornea, they have these little pumps. The cells have these pumps. And what they do is they constantly pump out that fluid from the cornea to help keep it clear. So you can think of your cornea like your car windshield and think of these pumps like your windshield wipers. So if the pumps are not working to constantly pump the fluid out, as in Fuchs dystrophy, F-U-C-H-S, Fuchs dystrophy, then water builds up in the cornea and the patient doesn't see well. And that's because the cornea is like a sponge. It's made of collagen, it's like a sponge, and when it gets wet, it will swell. So that's Fuchs dystrophy. And Fuchs dystrophy is inherited in the genes. We can see it present problems at usually 40s and 50s years of age. 50s are more common, but patients can be much older when they start to have problems with this. We're not going to see this usually in a patient in their 20s, but if you're a patient who has, a parent, a mom or dad that has Fuchs dystrophy, and you're getting in your 40s and having any trouble with your vision, you definitely need to be getting an eye exam. Over the age of 40, it's recommended to have an eye exam every year, annually, so you need to let your eye doctor know about your family history. The way that we treat Fuchs, we replace the inside layer of the cornea. So we actually can replace just that cell layer that is not working properly anymore. So it is not a replacement of the entire cornea, it is only the cell layer. And the cell layer is only 10 micrometers thick. So on average, a cornea is about 540 micrometers in thickness. Some patients can have thicker corneas. That's just the way you are. That's just how you were born. But usually will be symmetric if that's the case. But on average, 540 micrometers is normal, and only 10 micrometers is the cell layer that needs replaced in Fuchs dystrophy. So we transplant the cells from another human cornea onto your cornea, and we transplant them as a sheet of cells. And we attach that sheet of cells to the back of your cornea with an air bubble. So air is placed in the eye at the time of surgery to press that sheet of cells on against the back of your cornea and hold it there. And the air will stay in the eye usually for 3 to 4 days. It differs based on various things, but it will stay in the eye and slowly evaporate out. When it evaporates out, those cells should have adhered to the back of your cornea like a suction cup, essentially. That's how I explain it to my patients. And it's very critical for that first week after surgery that you're not doing any heavy lifting, bending, or straining, that you're not rubbing your eye, because those cells only have the air bubble holding them in place. We can't suture them in place. We can't put a stitch. That would damage them. So, and the air is going to come out. So when the air comes out, those cells should be adhered and start to work to pump water out of the cornea, to pump that fluid out, that aqueous humor that's been sitting there, and help to clear your vision. In small number of cases, when the air comes out, the patient actually needs more air. So the patient returns for a week follow-up visit after surgery, and the air is gone, and the cell sheet that we've put in is only partially adhered, not fully adhered, and it needs more air to help it. So in the office, we can very simply put some more air in your eye to get you the rest of the way there. It's very rare that a patient returns a week after surgery for their follow-up visit and the graft or the sheet of cells is not attached at all. It's just totally floating around in the eye. We see that when people go home and do things that they're not supposed to do. So when you do heavy lifting, bending, straining, rub your eye, forget to sleep in your eye shield, put pressure on your eye when you're sleeping, that will dislodge that sheet of cells, and then we will be back in the operating room reattaching it there or getting a new sheet of cells from another human donor. The cells do not require, it does not require that we match you with your donor. So there are no blood vessels in the cornea. Multiple studies in cornea have shown over the years of transplant that matching for cornea transplant is not necessary. So there's no matching involved. So Fuchs dystrophy, and the symptoms are, a blurring of your vision. Usually we'll notice that your vision is worse in the morning when you get up and gets better throughout the day. The reason for that is that when we're sleeping and our eyelids are closed, evaporation cannot take place, right? So any fluid building up there cannot evaporate and it builds up. So when you open your eyes in the morning, as evaporation happens, some of that fluid that's built up evaporates off. So blurry vision in the morning, getting better throughout the day. You may have a positive family history and symptoms of decreasing vision, glare, halos. You just can't see to do the things you need to do. Get your eyes checked annually over the age of 40. Let your eye doctor know if there's any positive family history. And the name of that procedure is DMEK, D-M-E-K. D-M-E-K is where we replace only the inside cell layer and not any of the other layers of the cornea. That's the most advanced technological way to do it. And that's what's mostly being done today for this condition. If you have any questions, feel free to reach out to me, comment in the comments below, like and subscribe to my channel. I plan on doing lots more of these informational videos. And have a good day. Bye.